This content is intended to be educational. It is not designed to point the finger of blame at any single individual or entity. The series is a documentation of real people and their experiences with healthcare. Names, locations, hospitals, doctors, and other identifiable information have been removed to protect the individuals involved. This is meant to serve to educate the public and offer advice for people seeking medical care to better protect themselves and achieve the best health outcomes. This is a series about racism in the American healthcare system. We will be discussing the ways it harms patients and communities, the ways medicine has changed and has yet to change, and what you, as a patient, can do to identify inappropriate behavior and advocate for yourself. I'm a Master of Public Health, Doctorate of Medicine, dual degree candidate at the University of Colorado, working with 2040 Partners for Health and community and students together against healthcare racism. My goal for this project is to start a discussion to put a spotlight on the real picture of racism as it exists in the American healthcare system. In the words of the late Stan Lee, bigotry and racism are among the deadliest social ills plaguing the world today. But unlike a team of costumed supervillains, they can't be halted with a punch in the snoot or a zap from a ray gun. The only way to destroy them is to expose them, to reveal them for the insidious evils that they really are. This is from Stan's soapbox in 1968. So let us start by saying that word that is so offensive to the people it most strongly applies to: racist. I think a lot of confusion happens when people misunderstand this word. For many, the idea of a racist is somewhere on the far end of neo-Nazi, a KKK member who advocates for the resegregation of community and tells people of color, go back to insert potentially wildly inaccurate country of origin here. That's a racist. To which I would say, well, yeah, obviously, but it's past time to acknowledge that somebody so extreme isn't the only person that the word applies to. The Merriam-Webster Dictionary defines racism as 1, a belief that race is the primary determinant of human traits and capacities, and that racial differences produce an inherent superiority of a particular race. 2, a doctrine or political system based on the assumption of racism and designed to execute its principles, or a political or social system founded on racism. And 3, racial prejudice or discrimination. I hope no one will be shocked that I could conclude from this definition that racism exists on a spectrum, and that one could be racist and not really be aware of it. This definition isn't about malice. It concerns behavioral practices among all people, regardless of ethnic background or country of origin, that, whether intentionally or unintentionally, causes harm to others. I would argue that to have bias is as human as eating or breathing. We can't be expected to understand things that we don't experience, and as humans, we tend to distrust what we don't understand. If you have done or said something that you realize now or after watching this series was racist, take a breath. It's okay. People change, people grow. It's part of being human. If you can acknowledge that mistakes were made in the past and try to do better in the future, then you should be commended. Nobody's perfect and mistakes are part of life. You're not a bad person for not being born all-knowing. You are a bad person when the harm of your actions is brought to your attention and you do nothing to change them. So I keep mentioning these harms. What are they? And to be honest, it's hard to quantify, so I'm going to start trying to explain it with Jay's stories. Jay told me about a couple incidences that happened to her. The first story takes place when she was just a child, an early introduction to an unjust ways of a system that's supposed to offer help to all who need it. Quote, I remember I was around 12-ish. My mom had terrible asthma since she was a kid, and my mom is Black. We went to a network physician who walked into the room knowing she was having an asthma exacerbation. He just stood at the door with his arms crossed and said, okay, what are you here for? My mom tells him, I have asthma, I need help. And he literally stood at the door the entire time with his arms folded, asking her questions, did not examine her, did not listen to her chest, and was just like, okay, I'll prescribe your albuterol, or whatever inhaler he gave her at the time, and then he walked out of the room. And me and my mom just looked at each other like, is he done? Is he coming back? And we waited for 5 to 10 minutes and he never came back. So we were just like, oh, well, I guess that was the visit, end quote. Granted, it can be difficult to say in this situation that the doctor's treatment, or rather lack of treatment, of Jay's mother was due to her race. What can be said about the interaction without question is that this physician failed to do his job correctly. When it comes to respiratory issues, there are no shortages of causes. Everything from being startled to having a heart attack can cause shortness of breath. How would this physician have known the difference between asthma and any other cause? He wouldn't. The way to determine that is with the exam maneuvers that he didn't do. Talking to physicians for this project, we agreed that a good lung exam is always required when it comes to respiratory complaints. This is what I learned in medical school, and this is what doctors tell me they practice with their patients. We also agreed that he had all-around poor form for communication, which is going to be a common theme in all of these videos. As a student, I was taught to use communication techniques to confirm that the patient understands you and can voice concerns. When I talked to physicians about this story, they suggested that this physician should have done more to communicate the end of the visit. This is called closing the loop, asking if the patient has any further questions and confirming next steps. For example, I believe this is an asthma exacerbation. Based on previous treatments that have helped, I will prescribe you V drug. I have sent the prescription to W pharmacy. You should pick it up as soon as possible and begin it immediately. Use X dose every Y hours until symptoms resolve. You should return here if symptoms don't improve after Z amount of time or get worse. What questions do you have? This seems really simple, and it is. That's why your doctor's supposed to do it every time, to make sure you're both on the same page. There's actually a stupidly expensive section of the second medical licensing exam that requires you to do this with every one of a series of standardized patients, or risk having to take the $1,200+ exam over again. One can make the argument that this was just a bad doctor that shouldn't be practicing, and his failure to do his job had nothing to do with the fact that this woman was Black. Yet the fact remains that according to the U.S. Department of Health and Human Services, in 2015, Black women were up to 20% more likely to have asthma than their white counterparts, and Black children were up to 10 times more likely to die from complications related to asthma than white counterparts. This is partially due to a higher prevalence of people of color in low SES neighborhoods, causing higher rates of environmental exposures. Itself a discussion on environmental injustices for another day. Another component is the undertreatment of asthma in people of color by healthcare providers. So yes, you can argue that this one specific doctor is just awful to everybody. I don't know him, so I can't argue differently. However, the truth is, simply by being born Black, this woman is statistically more likely to suffer complications from her asthma up to and including death. Jay told me a second story of when she was much older. Quote, I wasn't sure if it was overt racism, but just the fact of me knowing who I am, and I don't know, you sort of get a vibe, it's hard to explain, end quote. She explained that she had gone to an urgent care for an infection on her leg. The physician basically asked her what she thought was wrong and treated her based on her suggestion without further questioning or workup. Quote, and that was the end of my visit. He spends the next 10 minutes talking about himself and talking about the origins of his name, his European ancestry. Again, a white male doctor, and I was just like, is he forgetting that I'm his patient? Where are the physician-patient boundaries, the physician-patient standard relationship and courtesy? Yeah, it was just a very strange experience in medicine, end quote. This one is a little more difficult to assess, although understandably a very uncomfortable experience for Jay. Granted, most infections don't take long to evaluate and treat, so the physician may not have needed much more information than what Jay gave to send her home with the appropriate antibiotic. I would certainly argue that, if nothing else, this was a pretty tone-deaf thing to do on the doctor's part. Imagine, hey, young Black woman, I see you are here for an issue that is very concerning to you, but let me take a bit of your time to reinforce how white I am. Now, sure, this almost definitely wasn't how he meant the interaction to be interpreted, but it was unprofessional nonetheless. He might have thought, however erroneously, that talking about his ethnic background would be a good way to build rapport with Jay. Maybe he needed to kill time while filling out the 2.79 billion checkboxes in the EMR. That's only a slight exaggeration. Truly, I don't think this man set out to make Jay uncomfortable, even though that is what he spectacularly accomplished. I think he probably wanted to do just the opposite, but I also think developing good practice of thinking before he speaks would go a long way in making him a better physician. Now, talking about yourself can be a good way to express understanding of another's issue and foster a bond. So, when is it appropriate for a healthcare provider to be talking about themselves to the patient? Generally, when asked. Providers have a very limited amount of time that they can spend with a patient in any given visit. That they would use that time to talk about something irrelevant to the visit rather than learn more about their patient is disrespectful, regardless of intent. This is the time the doctor could have used to ask about previous reactions to antibiotics, allergies, what to do if the antibiotic doesn't work. All important information. His totally irrelevant ancestry, completely inappropriate to bring up in this situation. Whether he intended to do harm or not, would you trust this doctor to give you the correct treatment? Would you feel confident putting your lives in his hands when given the opportunity to get to know you? He spent 2/3 of your visit talking about himself. Now imagine you have nowhere else to go. How willing would you be to seek care at all? And therein lies the real problem of microaggressive tendencies of these doctors. The lack of trust, the fear of medicine, the thought you may waste a lot of time and money for someone to not help you. On the same token, we should also keep in mind that just because this man was white doesn't mean he hasn't faced his own struggles that would give him some sympathy for what Jay experiences. Sure, being a white male is a kind of privilege, but similar to racism itself, privilege falls on a spectrum with many different forms. For example, while I may face discrimination as a woman of color, I have privilege in that I'm cisgendered. I lack privilege in that I was born and grew up in a low-income area, but I have privilege in that I was born to parents who were, and still are, married. I began this video with a quote from another old white male, Stan Lee. Certainly he had privilege for being white and male, though likely faced discrimination for having Jewish ancestry. Is that the reason he was so outspoken against bigotry? Who knows? The fact is that one of the most blatant metaphors for the struggles of race and LGBT groups in the US, the X-Men, and a massive step in the positive representation of African culture and box office bombshell Black Panther, need to be attributed, at least in part, to this old white man. Privilege or not, everyone has the potential to offer understanding, sympathy, and comfort to each other, regardless of background. While Stanley wasn't perfect and had some missteps, including any number of poorly aging racial caricatures, it can be said that he took his stumbles in stride, and he and Marvel took steps to do better. Not perfect, but better. Jay herself contrasted the behavior of these physicians with a person who randomly shouted racial slurs at her while she was walking with colleagues from school. Quote, "I remember feeling like, wait, what? Did that just happen? What was that?" I feel like the people who were with me in the group also heard, but I don't know. They just didn't know how to respond, or they were just as shocked. Because we were walking and this person on the other side of the street was just like, and the conversation stopped, and then we just kept walking and it started back up again. I remember just going about the day because it was a busy day. We were doing work for a class and I didn't think too much about it, but then later when I actually got to sit and process, it was really hurtful. I remember feeling angry because I was just like, that term, I associate with people using them as being ignorant, making assumptions about someone. I just remember saying to myself, no, I am not that word. That word does not define me. I am intelligent, I am driven, I am all of these things, but I am not that. End quote. When facing discrimination, it feels like it comes from all sides. While the most aggressive people are few and far between, it's the little interactions every day that hurt the worst over time. A sort of death by 1,000 cuts. Racism doesn't have to be someone in a MAGA hat swinging a flaming torch at you. Racism is woven into the very fabric of our country, from its genocide-based founding to the slavery-based economy of a mere 150 years ago, to the modern-day school-to-prison pipelines that punish children of color more harshly for the same offenses. Racism runs deep in our country. There's no getting around that, and for better or worse, doctors are just people. We have biases, the same gaps in understanding, the same distrust as anybody else from our background, yet we are also in a position where that bias could be the final factor that ends someone's life. Yes, we are all human, we are all flawed, we've all made and will continue to make mistakes. Some of those mistakes will have worse consequences than others. None of us will ever be perfect, but we can do better.